And I remember Republicans struggling to figure out what their response was. And they didn't have a market response. They knew they were against what Hillary Clinton wanted, primarily because grassroots Americans were against what Hillary Clinton wanted. But they didn't know what they were for. And I was like a healthcare staffer called on something called the Republican Leaders Healthcare Task Force. And I got to sort of watch Republicans try to figure out what they stood for. And they had no idea. And we would bring in like pro-market, pro-medical savings account guys to talk to them. And I'd watch staffers afterwards, after they were gone, just sort of make fun of them. And these staffers, I won't name names, but they all became like lobbyists for the hospital association and stuff like that. Mm-hmm. So there was never like a pro-market alternative even back then. And so I wasn't surprised when Republicans couldn't repeal and replace Obamacare, because it was never at all clear what they were actually trying to do. Mm-hmm. So how do you actually take some of FREOPP's ideas and inject them into this debate and actually get people to imagine a health insurance marketplace?
Well, our whole philosophy on policy, whether it's healthcare or housing, education, justice reform, energy, when we set forth policy recommendations, we want to make sure that they are viable. And what does viable mean? It means that they can reasonably get 60 votes in the Senate. And in order to do that, unless you're waiting for Republicans to have 60 people in the Senate, which is not going to happen for a very long time, and also have the House, and also have the presidency to sign it into law, then you're going to be waiting a long time. So you're going to have to get some Democrats on board. And how we look at policy at FREOPP is we try to achieve what are typically thought of as progressive outcomes by using free markets. And so when you think of the concept of universal health coverage, if you were to say that, kind of the first thing that would pop into your head is that's a Democrat talking point. Mm-hmm. But if you look at any other sector of our economy, for example, for every American to have access to an affordable smartphone or a television or a car, we wouldn't say that the federal government needs to be more involved in the smartphone market and dictate prices there so that people can have access and we can achieve universal smartphones for everybody. So why should it be any different for these really important policy questions that we're asking today and these challenges that we face in America on the healthcare front, housing, education, et cetera?
Yeah. So when you say universal, are you talking about universal access? Are you talking about universal coverage? Because those are of course different things. Are we talking about health insurance or access to healthcare? How do you guys see that?
Well, I would say it's universal access to coverage, but if you make a lot of the changes that we're talking about, it makes insurance more appetizing to buy because it's cheaper, you get more benefits, you get more choice in what kind of doctors you see, in what kind of benefits your plan includes. And so when people have access to affordable coverage that suits their individual needs and the needs for their family, then they're more likely to take that coverage up. And so hopefully, in the end goal, we can get to universal coverage, period.